Ladies and gentlemen, welcome to Australian Indian Radio's live stream, and we feature today the Australian Indian Medical Association's Queensland chapter and their monthly installment. So let's say hello to IMAQ.
Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland. They volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMAQ Queensland, Dr Cyril Fernandez, to introduce to you our guest speaker of this month.
Hello listeners, we're back again. The program of the Indian Medical Association, Aapki Sehat, meaning your health, which is a monthly program. Today we have the pleasure of talking and listening to Dr. Dilip Dhupelia, a well-known senior general practitioner, fellow of the Royal Australian College of General Practitioners, fellow and associate fellow of Royal Australian College of Medical Administrators, fellow of the Australian Institute of Company Directors, and the immediate past president of the Australian Medical Association of Queensland. So on this Aapki Sehat program, I want to introduce you to Dr. Dilip Dhupelia. Eli has already spoken to you about this public health message from the Indian Medical Association of Queensland. So Dr. Dhupelia, let me start with my first question. Please tell me about your background, educational, professional qualification experiences, and so on, please, Dr. Dhupelia.
Thank you, Cyril, and thanks to the IMA and inviting me along today to speak to the Australia India Radio. So thank you very much. Look, my background is where I was born in South Africa, but I did my medical training in Ireland, in Dublin, and I completed my internship there before I moved to Queensland. And ever since then, I've been in Queensland. I've been a GP obstetrician in Toowoomba and Millmerran for over 25 years. And then I became the senior medical advisor for the Commonwealth in Medicare Australia for about a period of 4 years. And after that, I've been working for the last 10 years in Queensland Health with the Queensland government. And what I do is actually I'm involved in the training of our rural doctors for Queensland. It's called the Queensland Rural Generalist Program. And that's what I'm involved in currently. I also do some general practice and aged care services as well, just to keep my clinical skills up, and very much involved with politics and boards as well.
Yeah, you have a fascinating medical journey, Dr. Dhupelia. Thank you for sharing with us. You know, GPs are the cornerstone of coordinated primary care and play a big role in preventive medicine and health. We know that general practitioners covers birth to grave medicine. Can you please highlight the salient aspects of general practice from your number of years of experience in not only delivery of primary care, but also being involved in policy decisions affecting primary care, Dr. Dhupelia?
Yes, so there's two parts to that question. The one is about the primary care and one is about the policy for primary care. So if I may start with the first one first. One of the most amazing things in Australia is that we have probably the finest general practitioners in the world. Our training standards are very, very high. So we have good general practice training, we have good education for general practitioners, we have wonderful resources to train GPs of the highest caliber. We have standards, accreditation standards, and we have a requirement to do continual professional development throughout our lives. So it's a learning journey from the time we actually get our fellowship as doctors. So we should be very lucky that we actually have such high-skilled doctors. And as you know, a large proportion of our general practitioners are also Indian doctors who have actually come from overseas and settled in Australia. And it's a compliment to them that they've actually achieved the fellowship of the Australian College of General Practitioners. So the community needs to have a very high level of confidence that when they go and see a GP, that they're getting the highest level of care. From the policy point of view, we have to influence what we call the quadruple aim. And essentially the quadruple aim is a framework for us. It's an overarching framework that actually has 4 principles. So the best patient experience, best patient outcomes, minimizing the healthcare costs, and clinicians having a very good experience. So that's the quadruple aim that we've got to work at. And people don't realize the power that we have in general practice, because we are directly in control of about 80% of all the healthcare dollars that are spent in Australia. It all starts at primary care, from their referral systems, and from there onwards, the health dollar is actually spent. What we need to do now is the fee-for-service that we have been having for years under the Medicare system has to change. Our population is getting older, and we're getting more and more chronic diseases, cardiovascular disease, diabetes, respiratory diseases, cancers, etc. So what the funding now should be is to fund general practice, to build multidisciplinary teams with all the allied health workers within the team, so it becomes a one-stop shop for the patients. So that mitigates the risk for them to develop further comorbidities, and it actually means that they're getting expert treatment in the one center, but above all, it is led by a GP.
All right, that sounds good, Dr. Dhupelia. Maybe turn our attention to the COVID vaccination program of Australia. The federal and state governments are heavily relying on private GPs, not only to administer the shots, but also to gain confidence of their patients to receive vaccination. There has been increasing frustration amongst GPs regarding the certainty of supply of vaccines. Can you please comment on the current situation of this COVID vaccination, Dr. Dhupelia?
Sure, that's a very interesting question and a very current question, and I'm sure most of your listeners are very keen to hear what's going on as well. So as you know, originally the government had a plan to only limit to about 1,000 places all over Australia where you could go and get a COVID vaccination. But it soon became a realization to the government that the only way the vaccination program is going to succeed is to involve general practice. And so rather than limit the number of centers, they decided to call an expression of interest to general practitioners who will give the vaccine, because the Commonwealth knew that it is the doctor-patient relationship that GPs have that will actually influence the uptake of the vaccine, and to give their patients a confidence after they have their questions answered that they may have from their loved GPs. So 4,700 practices did an expression of interest, and they met certain criteria and were accepted into the program. Now, out of that, 3,400 practices are getting 50 vaccines a week. About 400 of them are getting, about 700 of them are getting 300 vaccines a week, and there's a few practices that are getting about 1,000 a week, depending on the size of the practice and where the location is. So the supply has been slow because we've been actually depending on an overseas supply before we can make our own supply. Our own supply is being made by CSL here in Melbourne. The overseas supply, you may have heard in the news, has been blocked by the European countries because they actually feel that there's a bigger need for them in Europe than in Australia. So we're actually starting from ground zero. For example, when we do our yearly flu vaccination, we already have 15 million flu vaccinations already produced before we actually release them into the market. So there's abundant supply of flu vaccinations. For COVID, we started from zero. And last week, CSL produced 850,000 vaccines, and from this week, they'll be producing 1 million vaccines every week. So the supply will grow, and it's understandable that people are getting frustrated and GPs are getting frustrated because the supply is not flowing. The other thing the Commonwealth is doing is that they're actually holding back some supplies because patients have to have the second dose. Those receiving Pfizer have to have a second dose in 3 weeks. So we actually have to make sure that they actually have vaccines to get it in 3 weeks' time. Those who are having AstraZeneca, they have to wait 12 weeks. So once the government has got sufficient vaccines stored for the second shots, they won't be holding back any more vaccinations. And the 1 million vaccines a week that are flowing from CSL from this week will actually ramp up as well. And I think that you'll find that most GPs and most patients will actually feel a level of satisfaction that they're actually now getting supply. So that's actually what currently is occurring.
Dr. Dhupelia, that is quite an extensive way of giving our viewers the highlights on the vaccine situation in Australia, and thank you very much for that. Look, I'm also, our medical center where I work is also involved with imparting the AstraZeneca vaccine. Even today we were running vaccine clinics at the center. There are different centers in and around Australia. So thank you for this input and wide information for our viewers. Now, Dr. Dhupelia, let me ask you something about your hobbies. What do you do, like in your interest out of medicine? If you don't mind for the viewers listening, pleasure, please. Thank you.
That's an interesting question. I mean, there's not too much spare time of us being doctors, but
Absolutely.
For those people who know me, they know that I love rugby union and all sports, but I'm actually a rugby union fanatic, following the Reds and Queensland Reds and the Wallabies. I was very fortunate that I was able to go to the World Cup in 2015 in England and 2019 in Japan, and I've already started making plans, COVID permitting, to go to France in 2023 to see the World Cup there.
Oh,
I also like, obviously, family time, my 6 lovely grandchildren, and to spend time with them is always a pleasure for me. I live in the city, so I actually enjoy doing early morning walks across the city, and it's quite amazing for me to see how our city of Brisbane is actually transforming into a very, very beautiful city day by day, and it's actually quite amazing to see what's actually occurring when you're walking around the city. I love learning about stocks and shares, and of course to learn about the Australian wine regions as well.
Oh, that's a wide range of things outside your field of medicine. I'm sure our viewers will be very happy to know that you find time for all these things, Dr. Dhupelia. Look, Dr. Dhupelia, many GPs tend to have a special interest in some areas of their medical field, such as men's health, women's health, skin, mental health, and so on. So, based on your wide range of experience, can you please highlight on your special interest area as a health practitioner, please, Dr. Dhupelia?
So I think that at this stage of my life, the message that I actually want to give your listeners is how to remain healthy. I started off the interview that you started off with asking me about general practitioners, and I told you how experienced the general practitioners in this country are. So my take-home message to remain healthy to your listeners is you must have a GP. You must get yourself a GP, you must get a bond with your GP, and you have to actually teach your children to actually have a relationship from a very early age with the GPs, because the GP is the cornerstone of your practice. Now, for those of your Indian Medical Association doctors who may be listening, I also have a message. They should stop treating themselves and they should stop treating their families. Go and get yourself a GP. I got myself a GP, and it was quite liberating to be a patient in a room and not a doctor, and quite liberating and a burden off your shoulders that you no longer have to treat your own family as well. So my take-home message is to remain healthy, go regularly to your GP, and make sure you actually get a relationship, a long-standing relationship with a highly skilled GP, and there's plenty of them around in Australia.
Dr. Dhupelia, that was indeed a very good message to our listeners and doctor peers on maintaining a healthy lifestyle of physical and mental well-being. So on behalf of the Indian Medical Association, I take this opportunity to thank you very much for your precious time and imparting your knowledge and experience to the listeners. Thank you, Dr. Dhupelia.
It's been a pleasure to be here. Thank you.
So, ladies and gentlemen, that's been the May episode of Aapki Sehat, meaning your health, brought to you by the courtesy of IMAQ. And today's special guest was Dr. Dilip Dhupelia. Until next month, it's goodbye from us from this segment.